How does bladder squamous cell carcinoma research vary worldwide? Imagine a puzzle where each piece represents a different part of the world, and how much we know about bladder squamous cell carcinoma depends on where you look. This type of bladder cancer is less common globally but is more prevalent in certain regions. In areas where infections like schistosomiasis are common, such as parts of Africa, Asia, and South America, bladder squamous cell carcinoma is seen more often. This contrasts with Western countries where urothelial carcinoma, the more common bladder cancer, dominates. The differences in disease patterns are linked to regional risk factors like infections, environmental exposures, and lifestyle habits. For example, chronic irritation from infections or inflammation increases the risk of squamous cell carcinoma in some regions, while smoking and chemical exposure are more typical in developed countries. Research activity also varies widely. China leads in the number of studies focused on bladder cancer biomarkers, showing a strong research push in Asia. The United States, Japan, Germany, and South Korea follow, indicating active research efforts across North America and Asia. Interestingly, Spain produces fewer studies but has high-impact research, meaning their work is often highly cited and influential. When it comes to clinical trials, North America, especially the United States, is at the forefront, with many studies exploring new treatments. Asia-Pacific countries like China also contribute significantly, along with European nations like Spain. These trials often focus on cutting-edge therapies such as immunotherapy and targeted treatments, aiming to improve outcomes for advanced bladder cancers, including squamous cell types. Despite the global effort, research on squamous cell carcinoma specifically is somewhat limited. This is partly because it is diagnosed at later stages and responds less well to traditional chemotherapy. Its higher prevalence in certain regions means that local health priorities influence research focus. In areas where infection-related bladder cancer is common, more attention may be given to SCC. However, in many parts of the world, the lower overall incidence means less research funding and fewer studies dedicated solely to this subtype. Healthcare resources also play a role. In lower-income countries, limited access to advanced molecular testing and clinical trials can slow progress. International collaborations are essential to bridge these gaps, allowing knowledge sharing and access to new therapies. Overall, the landscape of bladder squamous cell carcinoma research reflects regional differences in disease causes and healthcare infrastructure. While North America, Asia, and Europe lead in research activity, there is a vital need for global cooperation to better understand and treat this challenging cancer subtype. Remember, if you or someone you know is affected, consulting healthcare professionals is always the best step for personalized advice and care.